Welcome back to the Mojo podcast studio. Today we have a great episode for you on women's vaginal health and wellness. And instead of JC, Dr. Cullison, I should say, and myself sitting and talking about vaginas for the next while, we thought that our lead nurse, Giovanna De Almeida, would be a better person to facilitate that discussion with Dr. Cullison, who has over 30 years experience in not only urology, but female pelvic reconstruction surgeries and rejuvenation medicine. So these two are going to talk about how to help women enjoy sex better, and especially as they age. And listen, it's not fair. If you drive in your car and listen to the radio, there's all sorts of ads about men getting, their mojo back and getting erectile dysfunction fixed and solved and enhancing their sexual experiences. But there's never any ads out there for women, at least not that we see. And it's a really prevalent issue, especially as women age. It gets drier down there, and sex can be painful. It's really not fair what happens to the female body as they age when it comes to that. So there's help out there. There's techniques and ways to treat and solve some of those issues. And that's what our nurse Geo and Dr. Cullison are going to talk to you about today. Hopefully on the next podcast, I'm back. But today, no, you don't need to hear from two men about vaginas. So stick around, stay tuned, and enjoy the show.
Hey JC, I'm happy to be back up here with you. It's been a while since we've done a podcast together, I think. 2 months, probably?
Maybe 2 months.
Yeah. Well, I'm glad that we're doing this because I've been thinking since, starting to do this podcast today, that I'm kind of peeved about something. There's something that's kind of grinding my gears, and it's that there's lots of treatments that are talked about for men when it comes to sexual health or erectile dysfunction or whatever, and we don't talk about women's enough. So what are some maybe non-invasive procedures or medications that women can have to help with sexual dysfunction or any vaginal problems or that kind of thing?
Right. So in the men, it's a little more simplified in view, and it's typically a blood flow issue for erection. But with women, it becomes a somewhat of a vaginal tissue malformation that can happen over time, such as when they become premenopausal, perimenopausal, or postmenopausal, that the vaginal lining doesn't have the properties that it may have had when you were in your 20s and 30s. And when I say properties, it might be the sensation is not as pleasurable during sexual activity. It actually may hurt. The tissue might not be as elastic. The nerve and vasculature may have slowly been compromised over time to where you can't get the joy out of having sexual activity. So that's a long list compared to the more simplified issue with a male, which is almost 99% of the time they're coming in because of a vascular issue, and you just need to do something to increase the flow. They're equally as important. It's a little more complex in the female, so it's hard to advertise that on TV or make a short explanation of something that can address all those things. So yes, there is medication and some simple procedures you can do to get that back. You want to keep going?
If you want to, yeah. I've heard of a procedure called the Mona Lisa touch, and that it can be very helpful, but a lot of women don't have a lot of information on it. So what is it and how does it work?
So the Mona Lisa touch is one of a few other fractionated CO2 lasers that can treat the vaginal lining, being the external vaginal area and the internal vaginal area. And so fractionated CO2 laser technology basically is really where they take a CO2 laser, which is used to treat skin lesions and some other things used in medicine, and it basically fractionates it. It almost looks like a spray in the laser on the tissue. So it's a many micro cuts. And so this laser is not new. It's been out over a decade now. It started in Europe first. And there's not a new and improved version. That same version has been out because just standard fractionated laser has been shown that it basically makes these micro cuts, and then your body brings in these healing mechanisms.
New cells to the area.
That's right. It'll start depositing new cells, laying down more collagen and elastin. And these have all been proven by biopsy. So putting that aside for a minute, I mean, you could biopsy a 25-year-old's vaginal lining or the labia or the vulva or anywhere of those areas, and then biopsy it 25 years later, and you see certain properties that you've lost and other type of cells have come in. So you try to reverse that process. And there's an epithelial layer that's very prominent when you're younger, and then later on those cells get replaced with a basal layer, and we don't need to go into detail of that, but the basal cells don't have the secretions, and they don't maintain the same pH and all the properties that make the vaginal health better when you're younger. So with this laser, I would say that this style of laser and vaginal estrogen or female hormone systemic optimization are the only things you can really do that really better that. I mean, there's suppositories like hyaluronic acid that's safe, but I mean, it's okay. But I mean,
it's not as effective.
Right. I mean, it's good and it can help.
Can you use them together?
You can. Yeah, they don't overlap at all. Hyaluronic acid is already in our body. We use it in medicine as well for certain things. And so, with the laser, you know, it's about a 10-minute procedure, maybe less. And you basically, it's a probe that's probably a 3/4 inch diameter that goes in the vaginal area. And there's some people don't even notice anything but a little tingling sensation. Some people might get a little zipper or a little burner here and there. But it's typically every time I've done this for the last several years, the female patient's talking to us while we're doing it. We're having a conversation. So they're not sitting there just trying to endure this, you know.
I mean, and we use a little bit of lidocaine, right? So
right at the very beginning, we put on topical 5% lidocaine cream, mainly for the outside and just about the first inch inside. The more depth of the vagina, so just to make it clear, we do treat the entire inner walls of the vagina as well as the labia. And so most of the aesthetic cream is we put on for 20 minutes is really for the outside and just about an inch within. It's not necessary deep in the vagina, so we don't put it in there. So yeah, you sit there for about 20 minutes and surf your phone and chill out until we come back in.
Yeah, sounds easy.
So there's usually 2 people in the room, and you know it's not very loud or anything like that. And the attachment for the laser. There's 2 of them, one for the inner vagina and one for the outer vagina. That's 2 different ways of doing it. And basically it's a circular motion, so it treats circumferentially the entire inner vagina, and then you change the probe, and then you treat the outside. Really, I just sit there and mark those spray painting patterns, I call them, and you can see it. I can see it.
Yeah, I was going to ask, how visible is it, and how long will you continue to see?
Oh,
does it
only
heal
a couple
pretty
days.
Quickly?
Oh, yeah.
Okay.
That visual is gone within 24 to 48 hours.
Oh,
yeah, that
quick.
is. Yeah, it's very minute little, and I can see it. It just looks like a centimeter square box pattern that's, you know, when I'm doing the outside, and I make sure I get everything, and I go from the inner vagina just, you know, about an inch in and come all the way out to the labia and treat all of that. And, you know, we put on a little Aquaphor cream at the end. And
do they have to continue to do that?
Only for a day or 2 at best. Some people do it once and that's it.
There's like an initial amount of dryness after the procedure, or what are the side effects, or what should be expected afterwards?
Oh, I wouldn't call it, it wouldn't be dryness. It's typically a clear discharge and maybe some itching kind of a sensation. But bleeding, no, nothing like that. It's very short duration. In fact, going from one treatment to the next, you were probably going to ask this question, but the healing has been quicker than it has been anticipated. So the initial studies, you do these treatments 6 weeks apart, a minimum 3, up to 5, but you can do more than 5, but a minimum is 3. And so a lot of studies are based on 3 treatments 6 weeks apart. Now the more recent ones are done a month apart, which that's a new thing. I haven't been doing that, which we're going to start doing that because the symptoms from the procedure, you know, they're resolved pretty quick. Yeah. And you start seeing results in a week or 2. And you know, the first treatment has got the laser settings a little differently, so it kind of preps the tissue. And then from then on out, you know, we put it in a more stronger setting that does more. You notice more results. Some people just need 3. Some people need 5. And then there's the yearly maintenance and things like that. We'll get into that in a minute. But so really, this tissue, so I want to clarify that this laser, there's other devices out there that do laser, and some of them do radio frequency. They combine some other technology. We don't advertise vaginal rejuvenation. What I would just say is we're basically trying to remodel the tissue that's pleasurable for having better sexual activity and just better vaginal health, really, just from day to day of sitting and doing things. But you can add these other things, but really all we're trying to do is improve vaginal health to where we're not trying to make you tighter or necessarily the appearance. There's no doubt the appearance changes for the better. You can see it on the outside, but that's not what we're going for with this. I do not want to falsely advertise. Right. Scientifically, we're just trying to change the vaginal tissue. And the laser, it's not brand new. I mean, I had advertisements out a long time ago. It's not any different. It hadn't changed, but we're promoting it as a very cost-effective treatment to make the vaginal condition better. And the only other thing that's comparable to that, in my opinion, is vaginal estrogens or hormone optimization. I mean, really, the estrogen receptors in those areas really respond. See, when you get closer to premenopausal, perimenopausal, or postmenopausal, well, those levels are starting to go down. And so that tissue slowly declines. And they've done studies now that shows that the sooner you address that decline, the more effective the laser is, or vaginal estrogen cream. Yeah, I mean, if you have vaginal atrophy, let's say, 10 years. Now, everybody's different, by the way. One person 10 years post-menopause, the vaginal lining is different than another person's, and I can't explain why. Some drastically atrophy more than others, and I don't think it correlates necessarily with their estrogen levels. I can't explain it, but the sooner you are to that declining, at the beginning of the decline, you start doing it, you get better results, even with estrogen or,
and those the laser. Are the localized creams or like a generalized pellet situation?
Localized. The generalized does help as well, but because that starts getting into the arousal phase and all that stuff during sexual activity, the systemic estrogen, oral or patches or pellets or all those things. But the local vaginal estrogen, as well as local vaginal testosterone and some other combinations, which we do, which is not the focus of this podcast, but those also remodel the vaginal lining for the better. So really, those two are really the best for optimizing vaginal health. There's other things that are okay and do help some, but to really do it, those are the two. And so I have patients that just do local estrogen, vaginal topical, or they'll do the Mona Lisa, or they'll do both. I mean, there's no reason why you can't do both, really. In fact, on one of the more recent studies, it's interesting, there was about 40-something studies on it that were true studies, peer-reviewed, that showed the benefits of the fractionated laser. Then there was a little time at the very late 2000s, early 2020, it got some criticism. And you can find it online. You can find all the criticism on
Criticism on the lasers?
That it wasn't as effective. Not because there was complications. Okay. No, like that. It was just that, in this study here, we couldn't really demonstrate that it was better than estrogen or better than sham and all this. And I've seen all that. But then you start seeing some newer studies that, again, start to show that it's, these really well-designed studies, that it does make a big difference. And I saw this one where they basically just you did it to women that had used vaginal estrogen creams but had stopped 6 months because they were dissatisfied. Either they got nervous for using it, they were scared it might cause breast cancer or something like that, which I don't believe it does. Okay, that's another topic in itself. But for some reason they stopped for a 6-month period and they just went to the fractionated laser. And, and it was showing after 3 months, there was it was like a 90% improvement. And then at 6 months, it fell a little bit. And then at 12 months, it was down to 40 or 50% improvement. And so you would have to, again. Yeah, that's right. Yeah. You would have to have some maintenance because over time, it's just going to atrophy again. So you have to, it's the same way with the estrogen cream. People would do it for 3 months. So I'm doing fine, doc. Why don't we just stop for a while? Okay, Willie, whatever problem you were having is going to come back.
Yeah.
There is no magic one shot that I give you and I see you 5 years from now. We're not that good. But
when you say big difference that you can tell, what are the symptoms that women are normally presenting with that end up making a difference? Is it urinary incontinence? Like, does it work for that, or genital prolapse, or what kind of symptoms are the women experiencing?
From a scientific thing, they have like the vaginal health index, and then they have this vaginal sexual questionnaire, which is the symptoms that women will complain of, and then there's the objective appearance, like measuring the pH, the vaginal thickness, moisture, elasticity. That's the vaginal health index, and there's the things that the female complains of: itching, burning, bleeding with intercourse, all these little things. So anyway, I think I made your question too complicated, but so on the questionnaire that just deals with their symptoms, what they're reporting, yeah, it's been shown that a little bit of urgency and frequency type bladder control issues have been, improved with this. Some people have said that it fixed my problem, and that's fine. I don't like to advertise that, honestly, but it can definitely improve it. It's not going to make it worse. I mean, anything can happen, but that'd be unusual. And also some mild stress urinary incontinence. It's been shown to help that as well. So it's not a game changer in those areas. I would have to say that there can be some improvement. The more game changer noticed is just the vaginal conditioning that causes symptoms. The itching, the burning, the pain with sex, not having as much pleasure from sex, things like that. So somebody might come in and think, it just hurts when I do it, and I can't enjoy it. I can do it, but it's just, I can take it or leave it at this point because it's not pleasurable in whatever way. You might get a urinary tract infection the next day, or you just have some vaginal itching and burning the next day, or it's during the intercourse itself. You might get a small amount of bleeding and things like that. So that's a myriad of complaints there.
Yeah, I've had a couple of patients that have approached me and said, I'm like afraid to have sex because every time I do, I get an infection, or I have pain. So would it help in that aspect? Even though they're not postmenopausal, they're having this issue of every time they have sex, they get an infection, or they're having so much pain that it's just like, I don't want to do it.
Well, let's address the pain one first. So yes, it will, if you think about it, if this thing lowers the pH, improves elasticity, increases the ability for secretions, and there's a long reason why that happens, because if you start putting in more epithelial cells that come in and get laid down during the healing process, and less basal cells. The epithelial cells are the ones that make all the nice secretions. They're more elastic. They've got more vasculature, the nerve, and all this stuff. So the remodeling or the reconditioning, whatever word you like to use, is bringing that there. So your overall vaginal health should get rid of pain, itching, burning. So the recurrent UTI, now, that's a complicated topic in that I treated that for years. Women they were just plagued by it every time they have intercourse. And so there's all kind of medical things you can do that aren't with hormones. But if you are to change the pH in any way, like for instance, if somebody a female had recurrent UTI, some of them can literally just take a hyaluronic acid suppository. Those are available online without a prescription.
Oh, okay.
And so you're changing the pH, and you're also, it's a long story, but you're allowing the good bacteria in the vagina to feed on glycogen. And it's a long story, but it's an environment that you're creating to change it. Because there's millions of bacteria in there that are supposed to be, but there's a little handful of them that climb in the urethra over and over and over again. So the laser is not directly doing anything for that. The vaginal estrogen is not directly doing anything for that. You're improving or changing the vaginal health and conditions to hopefully revert away from getting those infections. So
it's just a secondary effect. It's not really directly related.
Exactly. That's being fair. That's exactly right. And so in the sexual activity, you're not passing. Some people come and think they're passing bacteria back and forth from their partner. Or no, all it is the millions of bacteria that are in there, the environment. One lady has this kind of bacteria, and there's some similar ones, but then there's the bad ones that might be more prominent in this one. In order to knock down the more pathogenic ones that can climb into the urethra, well, you can change the vaginal conditions in many different ways. And the two ways or one way of doing it that I just discussed. Some women, though, get into the weeds here, but some women have to take the night after pill or the morning after pill. This is a simple antibiotic, basically one that doesn't cause bacterial resistance. People get worried about taking too many antibiotics. There's 2 approved for that don't wipe out your gut and all your good bacteria.
Gotcha.
But anyway, so there's more than one way to treat a recurrent urinary tract infection. So to answer your question, it is one way that you could tackle the recurrent UTI by these 2 mechanisms of just improving vaginal health. Now, there's a whole lot of other ways to prevent UTIs too, because that's a complex subject. But I mean, if you're in your young 40s and you're not considered premenopausal by looking at the blood work, there are some people who still experience pain, or they're just not getting the pleasure that they had, or other vaginal conditions that are unwanted. And that's the way I used to advertise the laser. Is I didn't want to oversell it. Like, this is a way to treat unwanted vaginal symptoms, and that's not really reported anywhere like that. But that was the way that I didn't want to use vaginal rejuvenation. I didn't want to use anything about selling the appearance of it, even though it does change the external genitalia. So we just have women who do real well on it. So I used to quote that the success rate of resolving their issues that they came complaining was about 80%. You had some
that's great.
You get a rare person that thought, like, I'm not sure this is going to work for me. I have too much itching afterwards, and that you get that every once in a while. Nothing major, but you've had some people say, it's not right for me. But so majority of the people, they would come back, and then they'd come back on a maintenance plan. They'd come back once a year or twice a year. Everybody's different on their needs, but there's no long-term effects. There's lasers. The firing of a laser is so down to the millimeter, so it's safe. You can't harm anything else.
Yeah, it's not really going to damage it.
I mean, we're required to put on safety glass. That's a federal law. Any kind of CO2 laser fire, you have to have some laser goggles that we, as well as the patient, have to have them on. And there's some standards that you have to follow, but it's very safe. I mean,
Are there any patients that should not do it? Are there any contraindications?
If you're a keloider, well, scarring, it's a type of, you see it more in the darker skin people that, we would want to refrain from that. I mean, if you, very minor keloid, like that only happened very minute, like not really that significant, it'd be a judgment call. Yeah. But I would have a word of caution with that. Now, initially, they didn't want to do it on anybody that had previous mesh placements, transvaginal. But that's not really a contraindication. I mean, it's just, you could maybe irritate that or whatnot. But we've done it many times before on those that healed appropriately from a previous sling or a prolapse procedure or whatnot. By the way, you said something about prolapse a while ago.
Yes.
I make no advertisement that it can help anything with prolapse. That's, no, I think that's really about the only true contraindication.
So if you've had a history of cancer, you've been on chemotherapy, nothing like that will make a difference.
That's right. In fact, when I was in private practice, I mean, we had a lot of females that had been treated for breast cancer, and they were unfortunately had to be on the estrogen blockers, and all. I mean, it made the tissue very non-compliant. Now, I would have to say that's where pelvic floor physical therapy, which is a co-partner of ours at Progressive Pelvis, they really help in those situations where I can really help with the mucosa, the vaginal lining, but just beyond that, when it gets deeper into the pelvis, I mean, the laser does nothing for those things, and that's where somebody
that's a great combination of treatments.
Yeah, that's right. Exactly right. But, most of the oncologists, well, all the oncologists I've ever spoken with, or when I was talking to their patients that have had breast cancer, most were allowed to have vaginal topical estrogen because most of it doesn't get absorbed systemically all over. So those people are doing a combination of that and the Mona Lisa, or just the Mona Lisa by itself. It could help. It really does. And then there's a lot of unknown things. Vaginal topical testosterone mixed with estrogen. There's a little combination that you do on the external genitalia that works really well. Of course, we tell you some other tricks like refined coconut oil and the hyaluronic acid suppositories. There's others. So for those that have had lichen sclerosis, I was
about to bring that up. Yep.
That's challenging. Now, everyone needs to use the 2 different steroid topical creams for that. That's still the staple for treating that. But the laser, there are studies that look remarkable for that and studies that look just so-so on lichen sclerosis. And I've seen it do well for some and not others. It's just a challenging vaginal lining condition. But when I was first trained on it in the late 2000s, I went to a physician that did these on a regular basis, and half of them had lichen sclerosis that came from afar, and they were all coming back. And I actually would talk to them while the doc wasn't in the room. Like, well, tell me, really, is this really having you? She's like, yeah, I couldn't survive without it.
Oh my God.
So I don't want to oversell that, and we're not. It's just that's a challenging condition.
For our audience, can you just clarify what that is, what kind of condition that is, and how it affects them?
Well, lichen sclerosis is a term in dermatology, let's just say, that can happen anywhere. There's a male version of that. It's just a contraction of the tissue. We don't know why. I don't even think it's considered congenital or genetic. It just happens. And it's a challenging condition where, like, if it's on the vaginal introitus area in the labia, it contracts. It can tear easily. You'll get shrinkage. Mm-hmm. It lacks all the secretions that are needed. It's unattractive.
Yeah, that sounds painful.
It's a sad condition, and so those people immediately need to go on clobetasol as one, or triamcinolone. Those creams are essential to apply either once or twice a day, and they have to live on that. And of course, estrogen creams too. It's not a cancer. Estrogen creams help as well, but the laser allows that elasticity that they lack, because it'll become a rigid orifice almost. And
gosh.
Yes, and so the laser can loosen that, and those people will need to just keep coming back and back. And again, the sooner you start on something on that, the better. I'm not just telling everybody to be paranoid and panic, but it has been used to treat that. But it's being that it's a more challenging condition, it requires more treatments. We got to start at a lower setting to eventually get them to where, to get them back where they can have sexual activity without being uncomfortable. So, but that's not a contraindication. There is an indication to do it for those people. Sure. It's just more challenging.
Mm-hmm. Got it. Great. Well, I think I have all the you answered all the questions I had for you. If you want to add anything to that? Yeah,
I would just say in summary again, for improvement of vaginal health, whether you're in your 30s, 40s, or if you're 70, there's typically only a handful of things you can do to do that. I mean, systemically, as you mentioned, optimizing your systemic hormones, be it be topical creams or pellets, that can definitely help with sexual relationships in many, many ways. But just visual and topical vagina itself, vaginal health, the strongest two is topical vaginal estrogens with or without some testosterone. And fractionated lasers. The stuff with the frequency and those kind of things that they have that are not lasers for that, I think that can, unfortunately, those offer some shrinkage to where they want to make it tighter and things like that. And that's not necessarily pain. That's very good for some people. But this Mona Lisa laser doesn't do that. We're talking about increasing elasticity, moisture, pH, all those things to make your vaginal health better. And really, estrogen and fractionated laser, I think, are the two best to restore that.
Best of both worlds.
And you can do them both. That's right. That's right.
Awesome. Well, thank you so much. This has been really great. I think it's important to keep talking about it and educating and showing women that there are solutions to their problems. So
there really is, and address them sooner than later is what I would say. And yes, they're here at Mojo. We're all about making relationships improve with sexual health and overall, optimization of hormones and just making you a better you.
Awesome. Well, thank you.
Thank you.